Probably the biggest change for service providers is that we're now suggesting in measurement-based care is providing data to clients, patient reported outcomes. So they've told you what they've given you that data. But I think I don't think there is often a discomfort that people have with, wait, is there any risk in providing this data to them and letting them see and learn about their own mental health and the ups and downs of symptom change. So I'll throw this to Sandy. I'm curious if you could share your thoughts on any potential risk within sharing data with clients.
Yeah. Oh, I'm so glad you brought this up. We used to hear this all the time in the beginning of our implementation, and especially from psychologists. I don't know how many psychologists there are out there, but we were all trained to do psychological assessment. And psychological assessment is so structured, and oftentimes there are, the secret questions and everything's it's confidential, like you don't share raw data, it all has to be interpreted, and that's all legit. Like I hope it doesn't sound like I'm dissing any of this. Like that's really important in psychological assessment, and making sure that tests are private and used responsively, and not, sharing test items or test data with clients. Um, this is not that. This is not psychological assessment. And so, for those of us who were used to psychological assessment, it sort of takes a shift. But we talked about these as patient-reported outcome measures, and often they're super brief. Many are in the public domain. Anybody could Google them and just take them themselves. And what we're basically doing is we're saying, giving people these face valid questionnaires. How are you feeling? They fill them out. They say, here's how I'm feeling. And then in the process, by giving their data back, you're saying, here's what you said you were feeling. So there's no trick to it. There's no massive interpretation. It's just what it is. And once you get comfortable with that, and it just opens up so many doors for creating a shared language about talking about difficult things, for you having the language about, here's what you said. Does this sound right? So I think it's about a mindset, and recognizing that the clients already know how they feel. You're not telling them something that they don't already know.
Having patients be able to access more about themselves and to kind of come into more understanding about what might be happening. I had this great supervisor once who talked about this idea of insight. And, there are lots of things we can think about that, but you sort of can't hand it down, right? It's something that the person has to experience and arrive at and kind of problem solve and process. So if data can help us take a shortcut there or provides a roadmap to that, I'm all for it. I think it makes things sort of concrete for folks and they can get their arms around it.